J.O. is a 5-year-old female that has a current illness in the past week of being tired, having decreased energy, a loss of appetite, sleep disturbances, and unexplained bruises on extremities. In her past medical history, the only problem that arose was measles at age 2. Her family history is clear, besides the fact that her grandmother passed at age 62 of gastric cancer. She is appearing ill, although they deferred the review of symptoms. Her social history is also appropriate for her age. Vital signs are all within normal limits, besides being a little tachycardia and her weight being just below that of a 5-year-old. Her skin was pale, as explained before, with multiple bruises on her extremities and other places on her body. Upon further assessment, the patient had palpable, non-tender 2-centimeter lymph nodes on the submaxillary chain, as well as mild cervical and inguinal adenopathy. There was petechiae on the mucous membranes of the oral cavity. In the assessment of the lungs, chest, heart, and abdomen, the only abnormal signs were the enlarged liver and spleen. When cancer cells spread to the lymph nodes, this can be an indication of hepatosplenomegaly. The lab results that were high included the white blood count, the AST, and the ALT. The hemoglobin, hematocrit, red blood cells, and platelets were all low. After examination, the patient was referred to a pediatric oncologist and admitted to the hospital. She was suspected to have acute lymphoblastic leukemia, which is abbreviated ALL. Upon the second clinical day, she was treated with irradiated filtered platelets, packed red blood cells, and allopurinol was administered. Day 3, she had induction therapy orders that consisted of prednisone, vincristine, and asparaginase, and intrathecal therapy with methotrexate on specified chemotherapy days. There was a question as to why the patient would receive multiple drug treatment instead of just having one drug and having an increased dosage. This is due to many reasons. The physician may want a certain treatment for specified areas of the symptoms and signs that the patient is exhibiting. If one drug were prescribed, then the patient may reach toxic levels and possibly or become addicted to the drug. For example, with the prescribed vincristine that this patient is receiving, this treatment is due to the lack of bone and marrow suppression, and if this drug was only given, then toxic levels may be reached and could be an issue. The normal treatment for this disease, ALL, would include therapy until remission with chemotherapy. It is important to remember that the B and T cells are associated with ALL, and the B-type cancer does not respond well to chemotherapy, so other routes may be explored for treatment. Glucocorticoids are normally introduced in ALL treatment as they often induce remission by 75%, which we all can agree would be great odds. This concludes case study 85 on acute lymphoblastic leukemia. Thank you.